evening, our dear viewers on KTV2. We welcome you again to our weekly program, Medical Advice. As you all know, we usually take a topic for every week that is of interest to our viewers. Today, we're having a special topic about dentistry. Follow us after this medical advice. Our dear viewers, we would like to welcome Dr. عصام Yusuf الحزامي, consultant prosthodontist and cosmetic dentistry. We welcome you, Dr. عصام, to our medical program.
Thank you, and I'm very glad to be your guest and to be with you guys in Kuwait TV. Thank you.
Yes. Dr. عصام, as we all know, being a prosthodontist, we would like to talk to our viewers about prosthesis. But before that, we would just like to have a few words about the adult number of teeth.
Usually, when we count the adult teeth, we talk about 28 teeth.
Okay.
This is the average, or this is the norm.
Yes.
That's excluding the wisdom teeth.
Yes.
So with the wisdom teeth, the total is 32 teeth.
Mm-hmm.
In general, when we count, when we mention, when we talk about 28 teeth in general.
Mm-hmm.
So even if you are missing the wisdom teeth, it's not something that we have to worry about. A lot of times it's congenitally missing sometimes.
Or abnormally implanted and then they are extracted.
Oh no, the wisdom teeth, they could be just missing.
Just missing teeth, yes.
So usually if we want to talk about the adult number of teeth, I think it's 28 is the right number.
Yes. Concerning our aging process and the decay that we are encountering with our aging, and the gum recession and the other medical problems usually of diabetes and other medical problems. Have you noticed that this decay and this recession of the gum is increasing in certain population of people?
I think globally things are changing. The access to food and sweet and desserts are more accessible now than before.
Yes.
I think the frequency of eating and the frequency of having a candy or a chocolate is becoming easier than before.
Mm-hmm.
And increasing the frequency.
Yes.
All of this is leading to increased number of caries and dental problems.
Okay.
In the 90s, there was a theory or a saying that they might not need that many dental schools in the future.
Mm-hmm.
They thought that the tooth decay will decrease. Mm-hmm. They thought that the dental problem will disappear. And by the 2000, they found out no, the number is still going on. The
and problem is still going on. I think we need more dentists now.
We need more dentists, and we need actually more maybe education and helpful guidance to the patient that they can help them, with the brushing and cleaning.
Yes, with the oral hygiene.
With the oral hygiene.
Yes. Concerning the implants that we want to talk about today and the prosthesis. First, we want to know when somebody loses a tooth at that area and he wants that space to be occupied, what is the first step that he would go to? Usually,
we have to know that what is the function of the teeth.
Mm-hmm.
Usually, the function of the teeth is aesthetic, to make when the person looks appealing and can smile.
Yes.
We're the only creature made by God that can use their teeth to smile. Also, the other function of the teeth is to grind and digest the food.
Mm-hmm.
Also, the teeth help us with the pronunciation and phonetics, so we can talk and speak clearly.
Yes.
If we lose a tooth, for example, if we lose one tooth, we have to evaluate the area. We have to evaluate the neighboring teeth. We have to evaluate the bone and the gum, and then we have to decide to the patient what is the best options. Usually there are 3, or maybe we can say 4 options. One of the first options is if everything is fit and the patient has the enough bone, lengthwise and widthwise, we can go with the implant, because as we know, the implant is a piece of titanium placed inside the bone.
Yes.
A lot of people, they think that the implant is above the gum and above the bone.
Just
no,
hanging there in the gum, that's what they
that's
think.
what they
They
think,
don't
yeah.
know that it's screwed down
It's
to the
screwed
mandible.
It's screwed to the bone, as you said, as you mentioned, and then they are also integrated or connected to the bone, and they become one piece.
One unit, yes.
Yeah, and this is the success of the implant if they become one piece.
Yes, we will talk more about the implants and the bone grafting in case there's a mandibular recession after this break. Follow us after the break.
Hi, this is Dr. d.غادة from Amiri Dental Center. What we're doing today, we're taking a fixture level impression on a dental implant. Okay, the proper healing time after the surgical part has been reached, so it's almost like 2 months to 3 months. Now what we're doing the prosthetic procedure. So today we're taking the impression over an implant, and let's see what we're going to do today. Now the best time to take the shade is before you do any procedure. The reason why is like the teeth is not dehydrated yet, so we want to take them at the hydrated stage. So what we're doing today, we're taking now, first we're going to take the shade of these teeth before we take any impression. Yeah, now we're having like 3 approximate colors, shade guides. So this is A3, and this is A2, and this is B3. So well, my selection would be A2, because it's a closer value, but then we can control the hue and chroma with the staining. So A2 is what we're gonna go with. This is what the base color we're gonna select for him, and then from there we can do the staining and more characterizations. Okay, now as you see, this is a screwdriver to remove the healing abutment. The healing abutment, what they do, the surgeon put the healing abutment to form the gum around it. So it's like called the gingival former as well. So this is what does it do to remove the healing abutment. Okay, this is the healing abutment, and that's the screwdriver to remove it. Okay, we remove the healing abutment. And now we are ready to take the impression. We have to insert the impression coping, and then we put back the healing abutment afterward. This is the impression coping. That's where it's going to aid us to take the impression. We have to put it, insert it into the implant, and then we take a silicone impression on top of it. Okay? Now this is after fixation of the impression coping. Okay. Now the next procedure is to take the impression on top of this. Okay. As you see now, my assistant, she's mixing the silicone impression. Now she's taking like the catalyst and the base, and she's mixing them together. And she would load the tray and hand them to me. Then I will inject the light putty silicone into the patient mouth, then I'll take the whole impression. Now my assistant load the tray with the putty. I'm injecting the light body PVS material into the patient mouth, and then I will load the tray also with the light body. So I'm loading the light body PVS on top of the putty, and I will take the whole impression here. we have to wait 3 minutes and a half until we get the proper setting. 3 minutes and a half has been done. We need to remove the impression now. Now relax. Okay, now this is the impression of the teeth, and this is where the implant was, the impression coping was. So what we're doing now, we need to assemble the parts back into the impression. Okay? Okay, now we're removing the impression coping from the patient mouth. So we can put it back into the impression. So we remove the whole impression coping. We will bring back the gingival former or the healing abutment. We're going to put it back. And we will send the impression to the lab to fabricate the working model where they can fabricate the crown, the final crown. We have the implant analog, and this is the impression coping, the one we just unscrew it of the patient mouth. We need to assemble these two parts together. Make sure it's fitted in there, and then we screw it together. Make sure it's tightly screwed, and then we have to put this whole assembly inside the impression coping, the impression actually. Now you can see there is a landmark into the impression coping, okay, where we have to guide them inside the impression. So this is a flat surface here. We have to look into the flat surface, into the impression. We need to guide them along each other. Okay. Now this is the impression, and that's the impression coping analog assembly. So we have to squeeze it in until it's knocked in there. So it's part of the impression now, where they're going to pour the stone or the plaster later on. As you can see, we finished the procedure today. What we did today is the first appointment of the prosthetic procedure, where we take the impression on the implants. So this is how the impression has been taken, along with the impression coping and analog assembly has been placed on. We will send this part to the lab where they're gonna fabricate a master model or a working model where they can fabricate a crown on. So let's say 10 days or 2 weeks later, we're gonna have a master model with a crown to be checked in and ready for cementation, and that's all.
Dr. Isam, as we spoke about before the break, that we were talking about the implants and how the mandible is supposed to be in a proper height and width for the implant to be screwed in. So the implants themselves, what kind of material can be used using these implants?
So far, the most successful material that has been shown to be proven clinically is the titanium.
Mm-hmm.
Titanium is a very abundant metal available everywhere. It's not something seldom available. No, it's available everywhere. We can use it. It's very simple.
Is it cheap? This is what the customer wants to know.
It's cheap for the manufacturer, but not cheap for the patient or for us to buy.
Who buys it? Okay.
That's why it was the best choice of metal when it was chosen to use the titanium.
Does it have any rejection to the patient or any infections?
Sometimes very rare, but it has been proven that the bone has the ability sometimes to, most of the time, and that's what we are actually looking for.
Mm-hmm.
The bone osseointegrate and become one piece with the implant.
Mm-hmm.
And I think the only metal or any material had been shown to have this ability was the titanium. That's why the titanium was chosen to be the choice of implant.
Metal of choice for the implant.
And
yes.
back to the options of what can we replace the teeth.
Yes.
The second option will be the crown and bridge.
Crown bridge.
Yes. Which is the fixed partial denture, we call it in dental terms.
Yes.
The fixed partial denture is a good option if the patient doesn't have the enough bone, or maybe they doesn't have the thickness or the length of the bone
To have the
place
implant, to place it, yes.
Also, it could be a good option if the neighboring teeth, the front one and the back one, have been treated with a root canal treatment.
This is a must before putting the bridge?
The bridge could be a better option.
A better
than
option,
than the
okay.
implant, because the two teeth has been treated with the root canal, and they must have a crown or a cap to cover them. So since we are capping and covering them, we can have the other option is to have the bridge, and avoiding going through a surgery and doing implants.
In case that the mandible doesn't have enough bone, we've heard about bone grafting in these areas. How much successful is the bone grafting, and is it widely used in Kuwait?
The use of bone grafting is widely used now, but we have to understand that every time we use the bone graft, the success of the procedure of implant is getting less, because we are talking about two separate procedures. Sometimes they've been done in the same time. When we place the implant, we place the bone, and sometimes been done before placing the implant. We place we implant the bone.
Yes, as we can see in the picture, Dr. Isam, that the implant is there in the picture, and there's like a crown on top of it.
Exactly, that's the metal part that you see in the picture is the implant. This is what's being placed inside the bone. You're not supposed to see that part. If you see that part, there's a problem.
Yes.
Because it's supposed to be covered by the bone. And then we have another piece that fit over the implant, and then the crown that everyone can see that fit over the implant in the end.
Yes. Dr. Isam, concerning the teamwork between the implant specialist and the prosthodontist, how is this coordination done?
The coordination is supposed to be done by evaluating the patient by the prosthodontist,
yes,
who can plan and give direction and give support and guidance to the surgeon where the place of the implant and the angulation and the number of the implant can be placed. Sometimes there's advantage of being one team by being the surgeon, and the prosthodontist is being done by the same person. This could be a good advantage for the patient, because the prosthodontist himself is the surgeon, and he can be responsible and he can manage it better in a better way. But in general,